Hi, I'm Graeme. In this video I'll share with you the most effective treatments for your trigger points. Now this is based on a review of clinical trials and other scientific papers, plus my 27 years experience as a chiropractor. And what I found was a lot of people are paying for treatments that will give them hardly any long-term benefits where they could be getting better. Now, you'd think that to find the most effective therapy, all you need to do is just look at the trials and see which had the best results, but it's not that simple, and I'll explain why. Now first, the trials have different numbers of treatments, measure things differently, and the trigger points vary in how bad they are, so it's very difficult to do a direct comparison. Now in saying that, there appeared to be very little difference between the common treatments such as needles, lasers and pressure techniques. Now next is, do you want to get rid of the problem properly or just temporarily relieve the pain? Now the reason I ask is that because practically all of the trials just measured temporary symptom relief. Now as I'll discuss later, they deliberately don't look at getting rid of the problem properly. Now lastly, just say you have the trial of two therapies showing that they're roughly equal, but one needs to be done by a professional while the other can be done yourself. Now, which is the most effective? Now, according to the trial, they're equal, but in reality, the one you can apply yourself is much more effective. And that's because for the professional one, you have to make appointments and pay each time, so you're only going to have a handful of therapies and stop as soon as you feel better. Now, with the one that you can do yourself, you can have practically unlimited treatment and keep going until you're properly fixed. Now, the same thing applies to a lesser extent if one therapy is painful. Now, if the treatment is nice and doesn't hurt you, you'll get the treatment earlier because you're not dreading it, and then get more of them. Now, understanding that, the effective therapy you need is one with proven therapeutic effects you can do yourself and doesn't hurt. Now, we're able to find only one therapy that does that. Now for the next couple of minutes I'll be going over background about what trigger points are and what therapies do, or you can skip ahead to the therapy that ticked all the boxes. I'll pop the time up here. Now, for those not familiar with trigger points, they're those tender lumps in your muscles that therapists find, and they're arguably the biggest cause of musculoskeletal syndromes such as back pain, neck and shoulder pain. Now, as well as that, they cause things like fatigue, alter your posture and reduce your flexibility, and because they can refer pain away from themselves, they can cause seemingly unrelated pain such as headaches, sciatica and even toothache. Now, looking at how they're diagnosed, it's very important to understand that even though a good therapist will find them in about 2 seconds flat, they don't show up in any scans or laboratory tests, so doctors usually don't diagnose them. Now, let's look at what the lumps actually are. Now, as this diagram shows, they're a combination of muscle spasm, muscle tightness, reduced blood flow and a build-up of waste products, all locked into what's called a positive feedback loop. Now that's like what happens when you put a microphone in front of a loudspeaker and you get a huge squeal until you switch it off. Now in this case, once the trigger points start to develop, the spasm tightens the muscle, the tightness presses on blood vessels, restricting blood flow. The restricted blood flow causes a build-up of waste products, and the build-up of waste products becomes toxic, causing more spasm. Now this cycle keeps on going round and round in circles with the trigger points gradually growing. Now as this diagram shows, they start small and gradually go over years or decades. Now at first you'll only know they're there if a therapist presses on them. But as they grow, they'll gradually tighten the muscle, restricting your movement and possibly altering your posture or causing fatigue. Now, eventually they get big enough and something aggravates them and they start shooting pain. Now, as this diagram shows, scientists call this activation. Now, I mentioned earlier about temporarily relieving the pain versus fixing the problem and how the trials just look at relieving pain. Now, when you get, say, a course of needles, lasers or manual therapy, you'll feel better, but what actually happens is shown by the blue arrow in this diagram. Now, as you'll see, what they've done is revert the trigger points back to the way they were before they started shooting. Now that's the opposite of activation, so the scientists call it deactivation. Now I'm sure you're going to see the problem here. Now the trigger points are still there, they're exactly like they were before they were aggravated. Now they're still going to cause problems like restrict movement, alter your posture and cause fatigue, and of course as soon as they're aggravated, they're going to start hurting again. Now, at this point I need to share with you how science is used to mislead people like you into getting courses of therapy that will never fix your problem. Now, at first you need to be very clear that a handful of needles, lasers or massage therapies won't fix your problem. Now, the best trigger point scientists in the world proved this when they basically hit the trigger points with everything except the kitchen sink for 12 weeks. Now, people felt better, but as this chart from their report shows, most of the trigger points were still there. Now, every scientist who does a trial on trigger point therapy would know this. So they do two things. Now, first, instead of getting rid of the trigger points, they make the goal of their treatment deactivation, which, as you've seen, it's just a technical term that means stop hurting. Now, what happens is that people, including professionals, don't understand this. They read deactivation and think it's something like a bomb disposal person deactivating a bomb so it's safe. But instead it's more like resetting a circuit breaker and leaving the electrical fault. Now, the other thing scientists do is deliberately just measure symptoms and not check whether the trigger points are still there. Now, of course they will be, but they don't want you to know that. Now, by doing this, they can write up their trials as a success. Then people selling needles, lasers or peddling techniques use these to suck people like you into paying for treatments that will never fix you. Now, with that, let's look at how you can be fixed. Now, we've seen from above that trigger point, that's a mixture of muscle spasm, tightness, reduced blood flow and a build-up of waste products, all aggravating each other, forming a positive feedback loop. Now, the purpose of trigger point therapy is to slow or stop that cycle. Now, this can be done at any part of the loop. Now, that's why we have so many different trigger point therapies. Now, as long as they address one or more of these issues, they'll help. Now, for example, massage helps relax the muscle, increase blood flow and squeeze out waste products. Now, this works on 3 parts of the loop, so it's a very good therapy. Now, the next thing is you need to keep at it. Now, the good part about the 12-week trial is that some of the trigger points were gone and others had diminished. Now, this tells us that if you keep going, they'll continue to diminish and more will be eliminated. Now, this could easily take 50 to 100 treatments. That's a big problem with professional therapists, but if it's something that you can easily do yourself at home, it's no big deal. Now, last thing is you need to reduce or stop the things that are causing or aggravating trigger points. Now, I'll link a good reference to that in the description. Now, this is the time I share with you the therapy that does tick all the boxes. It has proven therapeutic effects, it's very easy to do on yourself and very comfortable. Now, that therapy is vibration massage, where the head of the therapeutic vibration massager like this is placed over the trigger point and the vibrations are allowed to penetrate and have their therapeutic effects. Now, looking at the therapeutic effects, vibration massage penetrates like ultrasound, which is vibration at a different frequency, and it's scientifically proven to work on all 4 parts of the feedback loop. Now, basically, all you do is sit the machine over the trigger point and let the vibration penetrate and dissolve it. Now, you can usually feel the muscle relax as you do it. Now, I'll pop more info about that in the description. Now, as you can see, it's also very easy to just do, and because just the vibrations that are going in, it's extremely safe and comfortable. Now, with that, I'll show you what you need to do to get started. Now, first you need a proper therapeutic vibration massager. Now, massage guns won't work because they're designed to drive their heads in rather than vibrations. Now, the easy way to explain this is by looking at these 2 machines. Now, the vibration machines are like the yellow machine on the left, while massage guns are like the jackhammers. Now, the machine on the left sits on the surface and sends in huge amounts of vibrations, while the jackhammer is designed to smash the surface and not to send in vibrations. Now, likewise, massage guns don't send in anywhere near the therapeutic vibrations a proper vibration massager does, and they're much more likely to cause damage or hurt you. Now, I'll pop a link above to how to choose a machine, but when you look, you're going to find most machines on the market are either massage guns or ineffective consumer machines that are built to look good on the shop shelves rather than provide any serious therapeutic benefit. Now, when I was looking for something for my patients, I couldn't find anything I was happy with, so I built my own. Now, this is the one I was demonstrating with. Now, I'll link more info about them at the end of the video. Now, lastly, how to use a vibration massager to treat trigger points. Now, basically, all you do is find the trigger point, sit the machine over them for 30 to 60 seconds. Now, I've got some really excellent videos and guides on how to do this, so I'll link them in the description. Now, it's a guide on how to use your massager, one how to treat trigger points, and a host of them on trigger points for various muscles and parts of your body. I hope this has been very helpful. Now, comments and questions are most welcome, and thank you very much for watching. It has been most appreciated.